in their isolation period, resulting in them being added to the active case and being an active case longer, when before they would have been in isolation awaiting test results, but not on the active case list. Also this week, the CDC extended the home isolation period from 7 to 10 days from the onset of symptoms or from the first day of the positive test. That means there's a larger window for a case to be on the active case list than previously. Additionally, you'll have noticed there's been an increase in the percent positives in the number of Hispanic cases. The majority of these cases are related to 4 separate clusters involving several large households. Through the work of our staff, we've been able to, and are in the process of, contacting the people who may have been exposed. We want to clarify that based on onset of illness and the incubation period of COVID-19, we know this bump is not due to reopening our community. However, as it relates to reopening in general, we want to remind you that a bump in active cases is something we expect. It's even outlined in our reopening plan. As our community continues to open back up, we expect to see more cases. This is why it's increasingly important for people to follow the 5 key principles, such as washing your hands, wearing a face mask when you're in public, and maintaining 6 feet of distance, physical distance between you and other people. These measures won't just protect you, they'll also protect the people around you and help ensure that we as a community get to move forward and not backward in our plan. As we mentioned last week, the metrics surrounding the benchmark data on our website will be updated weekly. This week's update will take place tomorrow by 11 a.m. We are continuing to build out our website to provide more information and clarity about the metrics and benchmarks, and some of those clarifications will be available tomorrow as well. Now I'll open it up for questions.
All right, we're now accepting questions from our media partners via our live Zoom chat. First up from WBIR, how do you know if the mask you have is effective?
There are guidelines on our website and guidelines on the CDC website that talk about the types of masks that are effective and general guidelines for what those are and how they work.
Also from WBIR, what is the best way to wash/disinfect a cloth mask, and how often should you do so?
That's a great question. I think the recommendation is that you wash it daily, that you wash it in hot water. And this is just anecdotal. I use the gentle cycle in my washer and put them in my delicates bag so that they don't get messed up, and hang them to dry. I tried the dryer and they didn't tolerate the dryer too well.
Another question from WBIR. Some people, including state lawmakers, are commenting on the poor quality of the state-issued masks, calling them porous and comparing them to thin socks. How do you think these masks compare to some of the homemade ones?
I think the Tennessee Department of Health issued the mask. They are very different than most of the masks that I've seen. And so they are definitely different. They are made out of a sock-like material. They have enough thickness to them that I believe they provide some level of protection, and as stated by the Tennessee Department of Health.
From WBIR, we're hearing the true test of a fabric mask is that you should be able to blow out a candle with it on. Is this true? If not, is there another easy test people can use?
Do you mean you shouldn't be able to, or should be able to?
Should.
Okay.
Here.
I haven't heard that. Certainly we can look and see if that's a true test or not, but I haven't heard that.
You said yesterday you've gotten so far 58 total complaints about businesses/food sellers not following proper guidelines. What was the main nature of those complaints, and are you satisfied businesses are now complying?
I do not have the details of those complaints, as my staff are working those complaints. Our team here works those every one that get in. We certainly can look at that and have that ready for a future update, but it's not something that I have the information on.
Follow-up question is, what follow-up action is planned as it relates to these complaints?
So as we've stated previously, we follow our general guidelines that we use all the time in helping people stay compliant with our food code and other recommendations that we make. First, there's the intervention. They go and they educate the people about how to do things, make suggestions, work with them, go back and see if they've done them. If they haven't done them, we might try something else, or we might need to issue what's called a health directive. That's a letter that says, please follow our guidelines, or we might take further action. And that further action is called a health measure. These are outlined by the Tennessee Code, and clear, easy to find if you look for communicable diseases in the rules and regulations. Actually, it's the easiest place to find them.
From WBIR, how long will it take to see if we need to close businesses back down again?
So we have a couple of weeks of incubation. So we've just reopened. People are getting back out and doing things. So potential exposures are occurring now. And so in a couple of weeks or maybe a little more, we expect to see a potential increase in cases. So we want to see over a week or so what that does. Does it climb steeply? Does it just pop up and kind of cruise along? Ideally, what we'll see is it'll go up to a different number, but stay kind of flat. So, we talked a lot about flattening the curve, but we're also kind of broadening the curve. So we expect it just to stay up there. We don't expect the cases to go away for a while. We expect to have COVID-19 cases in our community for quite some time now, but we hope that number just kind of hits a ceiling like it has now and kind of cruises along.
From WATE, what guidance did your department give to the school system about procedures for graduation? Many parents are not happy about not being able to attend. Is that something that was considered?
We understand parents are unhappy, and these are challenging times for all of us. So the Tennessee Department of Education provided guidance for schools. We provided our plan, the 5 basic things and the recommendations for industry. So the schools used our guidance and the State Department of Education's guidance to write their plan. We were asked to review it, and we did so. We made a couple of recommendations, but they were the authors of the plan based on the guidance from those 2 different bodies.
From the Sentinel, another question about the masks. He says there are numerous people criticizing the mask given out free by the state of Tennessee. What is your best advice for choosing an effective mask for non-medical use?
I'm going to send you back to the CDC and the guidance there. The idea is that the mask is used it should trap droplets that would be coming out of your mouth when you breathe or talk or sneeze or cough. So if it traps droplets, it's effective.
From WBLT, how many healthcare and first responders have been tested positive?
That is not data that we track or report on, so we won't be tracking or reporting on that.
From the Compass, what has been the outreach to the Hispanic population? Has KCHD increased its outreach efforts in light of the increase in cases within the Hispanic community?
Well, even before there was an increase in cases, we've been reaching out to at-risk populations. As we know, immigrant populations are at risk for multiple reasons. And we've worked with our partners in the community who work directly with Hispanic populations, Centro Hispano and others, to get information out and educate them about the risk of COVID-19.
From WBLT, do you agree with the school's plan on graduations?
The plan is based on the guidance from Department of Education and our guidance, and so it fits in the guidelines. So yes.
From WATE, sorry, went down on me there. Following up with the school's question, what revisions did you make to the school's graduation draft plan? Also, if parents can't attend graduation in person in late June or early August, how can schools reopen safely in just a few days?
So first of all, we just made a couple of recommendations. It was up to the schools to decide if they were going to implement those recommendations that we made. And regarding the time frame and timing, right now the schools and we are trying to make recommendations for July's a long time away. And we're just going to have to wait and see. I think one of the things I'll circle back to is really it's up to our community whether we're able to really be able to have graduation in July. We need our community to follow those 5 guiding principles of washing your hands, staying home if you're sick, wearing a cloth face covering, and try not to touch your face. Sorry. So all those things are important in determining what graduation looks like. It's a flexible plan. It's not set in stone. The schools were very clear about that. So I think there's opportunity to reevaluate what's possible in July based on the situation, based on all the benchmarks that we're going to be watching.
From WBIR, what would you say to people who aren't wearing masks in public? There are a lot, especially in large stores.
People certainly have the liberty to choose not to wear a mask if they don't want to. Certainly, we would prefer that everybody wear a mask to protect each other. It's really doing the right thing for your community and stepping up and acknowledging that you have a role to play in whether or not our community continues to get to reopen or we have to go backwards and close things down again.
From WBLT, they wanted to check if you have checked the data on Knox County having a jump of 52.9% of active cases in the last 7 days, and is that concerning?
So I think I spoke to that during my written statement, but basically when we look at the data, what we see is that a couple things have happened. The shorter time frame to get test results means that we